So good afternoon, folks. Welcome to a CMR Health segment. We're so pleased to have Dr. Rajneesh Kumar, who's joining us from Total Health today. And we're going to be focusing this particular conversation on breast cancer awareness. Now, as many of you know, the month of October is Breast Cancer Awareness Month. It's an extremely important month for women and men to be aware of the implications of breast cancer and what are some of the things that they need to look out for. Of course, you know, we want to be concerned about these health issues all year round, but each month there's something that's highlighted with health, and October has been a long-standing month for breast cancer awareness. So Dr. Rajneesh Kumar is from Delhi, India. He received his medical degrees from the University of Delhi, graduating in 2004, and he is a postgraduate in internal medicine and anesthesiology in critical care. He's been practicing medicine since 2005, and he feels like this is a noble profession that he's dedicated his entire life to. So really, really interesting background. We will actually be speaking with Dr. Kumar in the future because he's also a clinical diabetologist, which I've never even heard of before, but that's quite a specialty. And I think it's a specialty that a lot of us here in the Cayman Islands could really utilize. So that will be another discussion for another day. But preventative medicine, you know, I think any doctor that is a wonderful doctor, they want to see you, but as much as you can, try to prevent the necessity to see them for certain things that are preventable. So Dr. Kumar, thank you so much for joining us here on the CMR Health segment. How are you?
Doing fine. Thanks, Sandra, for calling me on this portal, for sharing my ideas. Thanks a lot.
Okay. So you have a wealth of experience. As we get to know you in the course of, you know, the upcoming months, we'll go through some more of your specialty fields of area. But for today's conversation, as part of Breast Cancer Awareness Month, we would like to talk about, you know, breast cancer. Now, this is something that as a woman is obviously a particular concern to me. And I've even heard right here in the Cayman Islands of men also getting breast cancer. So we know the numbers. The numbers are that in 2020, some 2.3 million women were diagnosed with breast cancer, and it caused about 685 deaths globally. Now, do you know, is there any trending? I mean, is it trending upward? Is it trending down? Do we have any of this information and how, you know, how we're doing with breast cancer? Are we seeing less of it? Are we seeing more of it because of diagnostic tools? What's the general feel there?
See, Sandra, regarding the incidence, over the last 5 years, the incidence of breast cancer is increasing over globally, worldwide. The reason is because we are now becoming more and more advanced to diagnose the early cancers. And also the awareness among women of all age groups throughout the world is increasing. And a lot of practices I'm doing, for example, now we have declared October as a pink month throughout the world to increase the awareness of the disease. So overall, the incidence of breast cancer is increasing because our diagnostic tool is becoming more and more advanced.
Right. And that makes logical sense, right?
Yeah.
And of course, the diagnostic tools mean that we are actually, you know, catching it earlier, hopefully.
Yeah, right.
Early detection has always been one of the critical underlying message of breast cancer awareness. So tell us, why is early detection so important?
See, again, just like other cancers, we want to diagnose the breast cancer as early as possible so that we get more time for its treatment and again the treatment is of less intensity if we can diagnose the cancers early. This is implemented over all the cancer, including the breast. So in breast cancer, first of all, being an organ, external organ, it can be evident earlier and seen and picked up early. So we treat it as soon as possible with less intensity of the treatment, with less side effects, and with better results. That is, early the diagnosis, prognosis is better in breast cancer treatment.
Okay, well, that's good. Now, what are some of the detection tools that are used for detecting breast cancer?
Again, for breast cancers, medically, we use mostly the non-invasive techniques like ultrasound, a specific type of X-ray, which is known as mammogram, breast mammogram. Again, they are of two varieties. Like we can go with the conventional mammogram. That was like just an X-ray film, which is bought, and the doctor used to diagnose whether it's positive or negative. Now we have got more advanced mammograms, that is called digital mammogram or 3D mammogram, in which the machines are fashioned in such a way that we get a 3D view, a three-dimensional view of the breast, so that we can pick up even the smaller nodules or smaller masses inside the breast, which is missed with the conventional mammograms. And the third non-invasive module which we can use is MRI, breast MRI. But if I compare the mammogram with the breast MRI, the sensitivity thing is obviously more with MRI, but it's cumbersome and it takes a lot of time. But if you talk about specificity, the specificity is more or less same in both the mammogram and MRI. So we, as a doctor, we prefer mammogram because again, it can easily pick up any precancerous or any early stage breast cancers. And if we come to know that there is a suspected nodule inside or over the breast, then we can proceed with the invasive investigation that is called FNSE or biopsies to confirm the case, and then we further manage the case accordingly.
Okay. Now, I'm just curious, is there any of those that are more highly recommended than others, or
Yes.
what is it that we're looking at here?
The most recommended test out of all these three, which I've mentioned, is basically mammogram. And
Right.
again, out of mammogram, the more advanced version that is called 3D or a digital mammogram is preferred nowadays because now it's easily available throughout the world, and the results are much better because of its high specificity and sensitivity with least side effect, because the radiation exposure in mammogram is comparatively less with respect to other modalities like CT scan and all, and they can pick the lesion quite early with the better results. So mammogram is right now the most recommended test for breast cancer screening.
Very good. Thank you so much for that. Now, when we look at some of the sort of known causes or associations, in other words, there's some sort of a link that makes physicians think that there could be a cause there for breast cancer. What are we looking at? So we hear that some 90% of breast cancer is actually due to genetic abnormalities that happen because of the aging process. So is there much that you can do about a genetic abnormality?
See, Sandra, the concern is like if you go with the exact cause of breast cancer, medically, we haven't proven yet what is the exact cause of breast cancer. But we have come to know that this happens mostly in those individuals who has got some external environmental change which get interacted with the genetically susceptible individuals. And who are these genetically susceptible individuals? These are basically people who has got different kind of gene mutations. All the gene mutation leading to breast cancer is not true always, but it is true that the people who has got these specific gene mutations have got high possibility of getting breast cancers. The genes which are responsible for breast cancer are supposed to be BRCA1, BRCA2, and PALB2 type of genes. But again, they are not 100% proof that they on their mutation it will lead to a breast cancer.
Mm-hmm.
But there are number of environmental factors which are more or less very common, maybe around 80 to 90% of the individual, in which we have seen that breast cancer are significantly common. If you say about the environmental factors, these are basically inactivity, excessive body weight, consumption of excessive alcohol or tobacco, patients or ladies who has been exposed to hormonal replacement therapy while premenopausal or perimenopausal or postmenopausal phases, the ladies who haven't breastfeed their children intentionally. That means to say if there is a medical reason, there's no need to take stress out of this. But again, if because of some medical reason, the ladies who hasn't breastfeed their children, this is one of the factors in which we have seen that breast cancer are comparatively common. And again, the ladies who has been exposed to multiple radiation exposures, maybe medical or non-medical reasons. So these are the things, environmental factors, which are common in the genetically susceptible individual that can lead to cancers. But again, I would say that always this is connected to breast cancer. Answer is no. This can happen without any these environmental factors, without any genetic mutation. Yes, it can happen in ladies. It's common.
Interesting. All right. So of course there's other risk factors, and we will be in a little bit speaking with Kaylee Nowers, who's a registered dietitian, about how diet plays an important part here. But it's quite interesting that this isn't an infectious disease. So of course, this isn't something that you can catch by hanging out with someone or wearing or sharing clothing with them.
No.
There's no connection. So there's certain types of cancers, for example, HPV and cervical cancer, where there's a known viral or bacterial infection linked to the development of that. In the case of breast cancer, not so much so. We don't know of any of that. Is that correct?
No. In breast cancer, there is no association of any viral or bacterial infection till now. We haven't come to know about this. But there are other cancers like human papilloma virus, which is connected with cervical cancer, etc. But in breast cancer, you are right. Till now, there is no infection has been proven to have direct or indirect connection.
Mm-hmm. Now, we talked a minute ago about, detecting breast cancer.
Yeah.
And one of the recommendations is that women should be doing monthly breast exams.
Yes.
That this is also an important tool. How many cancers, do you know how many cancers are caught by a self-exam? Is that still, the recommended thing to do for women to check themselves each month?
Yes. First of all, Sandra, I will let you clear that breast examination cannot detect cancer. It can only detect a suspicion of cancer. That means to say, if a lady come to know about her breast swelling, suppose a swelling, a change in the color of the skin or the puckering of the skin or the nipple discharge, etc., or any obvious swelling she can palpate. In that case, she has to know that it could be a breast cancer, though technically 90% of such swellings are not cancerous in ladies. But this is a system that in which you should know that you need a medical help. Go to any preventive medicine specialist or a gynecologist or your doctor to just let them examine and come to know that if it's suspicion of any kind of cancer, we can proceed further with different diagnostic modalities. But for that, you will come to know only when you will self-examine your breast. For this, we use a term called manual breast examination, MBE. And again, this recommendation say that this has to be done by the patient himself. If he is not able to know, or she don't know about the MBE, she can go to different educational videos available on internet or contact her physician so that he or she can teach her how to do it. Technically, she should do it if there is no family history there. She can do it maybe 3 or 4 months. In 3 or 4 months, she can do it once. And if there is a family history, she should do it monthly, at least once, whenever she is comfortable to do it. And it should be done in both standing and lying down position. So it is recommended to do by every female over the age of 40 years. And the moment they have got some suspicion about this, she should visit her her doctor to just proceed further, what to do next.
Mm-hmm. Okay, very good. Thank you so much for that. So, what are some of the things now? You're obviously, going to be seeing a number of patients for different things during the month of October. Will you be reminding women of the importance of, having a mammogram? What is the current recommendation for mammography? Now, I think it was at one point every 5 years. Yeah. How is that change when you have higher risk? And we can talk about some of those risk factors, but what are the recommendations for how often you should go in and get a mammogram done?
See, Sandra, in the beginning, as you said, the two most important risk factors for development of breast cancer is first is female sex. Though this can happen in male, but the incidence of breast cancer in male is less than 1%. So we are more talking about the 99% cases, that is the female sex. Second is the age, more than 40 years. Now there are different societies or organizations which has given different recommendations. But the most common recommendation which we accept worldwide is all the women above the age of 40 should undergo at least once in 2 to 3 years the breast mammogram. This is the recommendation, and this is the most acceptable one. If she has got any family history positive, then she can do it before that also. That means by the age of 25 also she can start it, but there she can do it every 3 years. But along with that, she has to be taught about breast awareness. Breast awareness is the way in which she should look and feel of her breast, and she should do it monthly in that case. So for high risk people, we can start it at the age of 25. But for low risk people, or the people in which, ladies in which there is no documented history of family history of any breast cancer, she can start it after 40. This is the most acceptable recommendation.
Okay, very good. Thank you so much. I really, really appreciate that. Just having a look here. What are some of the, there's a 5-point code for hashtag breast cancer awareness. I wonder if we could go over some of those as well.
See, again, this 5- code is like, first is know what is normal for you. That means to say a lady, first of all, understand what is normal breast. And again,
that's one of the reasons, Dr. Kumar, that the monthly breast exam is very important, right?
Yeah. Now, what is happening since, as I said, that every lady, every woman has got different breast. I mean to say in look and palpation, they are different. So first of all, lady should know that which type of her breast is looking like and how this is looking and how she feels it. Because all ladies have got different densities of the breast tissues. For example, a breast of less age group, for example, 40 age group, will be firmer, rounded, and it will be comparatively non-shaggy, which is opposite in a lady of 70 years old female. And as we know that as the age increases, the risk of breast cancer also increases. So first of all, a lady should, whenever she feel comfortable, especially she can go to her restroom and all, she can stand above her waist without any clothes in front of the mirror and look at both the breast, whether they are similar, they are rounded, they are of equal sizes on both the sides, with skin texture over it normal. The nipple, any issue in the nipple like discharges, irregularity of the nipple, this can be seen. This is the first point. She should know about what normal breast and what is her normal breast is exactly looking like. Thereafter, she can palpate it in all the quadrants of the breast. For that, she can have one educational video about the breast manual examination. Then again, this was the second point, like how she look and feel. Then if we go with the third point, know what changes look like. For example, she notices any obvious swelling over the breast, or she feels that something is coming off the nipple, especially if it's serosanguinous, that means it's mixed with blood, then definitely she should become alert that something is wrong with the breast and she need a medical advice for that. The fourth point will be that whenever she feel it, this is, she has got less time. She should not leave it like this. Okay, it will be okay. It's a normal infection. You are not supposed to declare it normal infection. Let your doctor report it to the doctor. He will see it, examine it, and let you know that, madam, it's a normal infection or a normal swelling, or it's showing me a suspicion of breast cancer, and he will proceed accordingly. And the fifth and the final point will be that go with the breast screening. Again, this will advise your doctor, but again, be prepared that doctor will ask you for breast screening, if especially if you are more than 40 years or either there is a family history. And that breast screening will include first the non-invasive techniques like, as I said, ultrasound, mammogram, etc. And thereafter, he can ask you for biopsies if required.
Mm-hmm. And is the biopsy the definitive way then to check for cancer cells?
Yes, we cannot advise you go with surgery after mammogram. We can just confirm that, madam, this mass is maybe because of cancer, but biopsies are the definitive way of just proving it. That again, we need, even after diagnosis, we need the staging of the cancer. For that, again, we need biopsy and different modalities. Because in breast cancer screening, when we used to examine the patient, we not only examine the breast, but we also examine the different nearby lymph nodes. That is the axilla, the lower neck, the back, something, these areas has to be examined to declare which stage of cancer is this.
Right. All right, let's review some of the ways that we can reduce breast cancer. And then after that, if we can look at some of the myths concerning breast cancer, and then we'll speak to Kaylee from the nutritional perspective. So we have a whole list here of things that we can do to reduce breast cancer, including regular exercise, weight control, avoidance of harmful use of exercise. Now, what is defined as harmful use of exercise? How much alcohol would that be?
Again, there is no definitive limit for alcohol intake, which is safe. Okay. So again, if we say that if a person is taking 60 ml of alcohol per day for at least 6 years, there are incidents that in which there is increased chances of breast cancer and overall other lifestyle modifications. But again, this harmful limit is different to different individual, because if the person is coming from different ethnicity, different background, there is no definitive so-called definition for risky alcohol intake. So it becomes like, if you're a daily alcohol taking, or you have got any kind of alcohol withdrawal symptoms when you leave alcohol, definitely that is a dangerous level of alcohol which you are taking it.
Okay. All right. So we've got avoidance of exposure to tobacco smokes. I'm assuming that means both, firsthand exposure and secondary.
Yes. See, again, if we go with the reports which has been published in a number of journals in last couple of years, so we have come to know that active smoking is definitely directly related with the cancers, and the passive smoking, that means to say, if my wife is smoking, my mother is smoking in the same family, the chances are less. But again, if I am taking tobacco indirectly also, it increases the risk overall.
Now, let me ask you something about smoking. Does vaping, is that considered something that is high risk, or, is vaping not really that big of a deal when it comes to things like breast cancer?
See, again, I would like to stress upon that it is the tobacco about which I am concerned about.
Okay.
If your body receives tobacco in any form, liquid, solid, smoking, doesn't matter.
Right.
The moment it gets inside your blood, definitely you are at the risk.
Okay. All right. We have avoidance of prolonged use of hormones. So would that be hormone therapy that we're talking mostly about?
See, again, hormone therapy is generally given in two forms to ladies. First is like, I'm talking about oral contraceptive pills, the injection, different thing. And second is generally when it is advised to avoid the menopausal symptoms, perimenopausal symptoms. So again, my advice is to for reproductively active females would be to prefer barrier method. If they have got some concern, they can use it, oral contraceptive pills also. But the recommendation is if it is taken for more than 5 years in continuity, then only the risk factor, it is considered as a risk factor for breast cancers. So they can use it on intermittent basis with they can take the advice from the respective gynecologist. And again, it should be avoided to take over a long time, more than 5 years. So they can take advice from their respective gynecologist what to do in between. But definitely, if on personal level, if you ask me which kind of family planning measures you prefer, definitely I prefer the barrier method, because more or less it is of no side effects or least side effects over other modalities. And if you go with the hormone replacement therapy for ladies who are suffering from significant perimenopausal symptoms, in that case, again, it should be taken under guidance. It should not be taken on their own, and it should be taken for least possible time, just to avoid this risk factor for any kind of cancer.
Okay. And the list continues: avoidance of excessive radiation exposure. So what sort of radiation are we speaking about here?
See, again, whenever two things. Again, one is occupational exposure. The ladies who are working in any profession in which radiation exposure, for example, I'm talking about my X-ray technician lady, okay, or my dentist or my surgeon who are using different radiation techniques for their patients. I'm talking about occupational exposure. In that case, they should take extra precaution. For example, different kind of shields. For example, shielded jacket, shielded throat covers, shielded. These measures can be taken, and they should take it religiously. That exposure should be less. Second, if you go with the investigation, for example, any lady is ill and she need to undergo repeated investigations in which radiation exposure there. For example, CT scan. Here, she should tell clearly to the respected doctor or the physician that, sir, I have been exposed to CT scan 5 times, suppose, in last 1 year. Now he will decide or she will decide that what should be the exposure to the radiation. Still, if it is unavoidable, then definitely she should start the screening of breast cancer as early as possible.
Okay. Prolonged breastfeeding. So this is one that caught me a bit by surprise, because you mentioned earlier that there's sort of an important component to breastfeeding that can be beneficial.
Yes.
But then there's such a thing as going too far?
No, again, it has been proven that the breast cancers are less in ladies who have breastfed their child comparatively longer with respect to ladies who has stopped their breastfeeding early. So it doesn't mean that if you are not breastfeeding your child because of some medical reason, I said medical reason, so you will definitely get a breast cancer. No, not like this, but definitely this is one of the risk factors. So whenever a lady can feed her child, she should. I mean to say that this is beneficial for both the child, for his or her growth, and for the lady for decreased incidence of breast cancer.
Okay. So there's no such thing then as breastfeeding for too long.
That means to say, medically it has been proven that ladies, suppose there are 2 ladies, one lady has breastfeed for suppose 4 months and the other has breastfeed for 6 months. That means to say that the chances of the incidence of breast cancer is less in that 6 month fed lady with respect to 4 months. That means to say, feed the baby is more important. Yes. Prolonged doesn't mean that you will breastfeed for 2 years. That means to say, till you are happy, your child is happy, everything is in between, it's fine. But overall, I mean to say the incidence is less in which in the lady who have fed more comparatively to who has fed less.
Less, I see. Okay. Yeah. And then diet, and this is where we're going to talk about Ms. Kaylee and Nowers here in just a second. But diet containing vegetables and fruits full of antioxidants is really, really important. Yeah. Treatment of comorbidities, the treatment of things like diabetes and obesity, which, like I said, we're going to definitely pick up on the diabetes conversation. And then most important, of course, is regular screening of breast cancer after the age of 50.
Yeah. See, now what is happening here, for example, morbidities we have seen that the ladies who has got uncontrolled diabetes or obesity or any other lifestyle disease, the incidence of breast cancer is overall increasing in them. Okay, not because of early diagnosis, also overall also it's increasing because their body is not overall stable with respect to a lady who is non-diabetic, non-obesity. Because in last couple of years we have seen that if you say the incidence overall 40% chances are more in ladies who has got diabetes to develop breast cancer rather than those who are non-diabetic. Regarding the age, again, the recommendation is basically how we proceed that more the age, more chances are the breast cancer. So after 40, we say you should, but after 50, we recommend you must undergo breast screening for cancer.
Okay. All right. So let's go ahead and bring Kaylee into the conversation. Good day, Kaylee. How are you?
Hi. Nice to see you today, Sandra. I'm really good. I'm really passionate about the cause and getting prevention of breast cancer awareness out. It's close to my heart. So I'm excited to be here. Thanks.
Now, you are a registered dietitian. Is that correct?
Yes. So I am. I actually have a lot of experience with oncology patients, helping them through this process prior and after therapy.
Yes.
As well.
So the importance of diet, if you had to range or put it in a range of 1 to 10 when it comes to, breast cancer in particular, where would you place that? Number 1 being least important, number 10, of course, being the most important.
100. It's very important.
Yeah.
It's pretty much what are you putting into your body? How are you strengthening your immune system? How, even if you're going to go use the medications, you're going to use chemo or radiotherapy, whatever your treatment is, you're going to need a strong immune system to support you through these treatments, because they do have an effect on how your outcome is going to be.
Wow. Okay. So we were just hearing that, for example, keeping one's weight under control, addressing, diabetes, which is often a lifestyle and diet related comorbidity, addressing issues of obesity, even alcohol use and consumption, all of these things, and even the introduction of additional hormones into your system, all of that can be tied in to one's diet. So give us a little bit about, what are some of the things that people should be looking at to increase in their diet? And what are some of the other things that we can say should be decreased in the diet to really, before, you even get a diagnosis of breast cancer, to really help you to perhaps not get there or prolong it for much further on in life?
Just speaking on with the alcohol consumption, what happens is when you're drinking an excessive amount of alcohol, the absorption of your vitamins and minerals decreases. So you won't be able to be taking in, even though you're taking in lots of fruit and vegetables, the absorption isn't there. So it's going to be useless. And also then you'll be drinking alcohol instead of having a balanced diet, which then you're going to have to take your medication. So that's why we suggest don't be having a large amount of alcohol a day. With regards to the recommendations of what you should be keeping diet, there's lots of different anti-diabetic diets out there, and a lot of people saying, oh, you must take this multivitamin and you must have this supplement. I would suggest just prioritizing your wellness by fueling your body with the right types of nutritious foods. So the foods being your anti-inflammatory foods. So things like, studies show that regular intake of basil, turmeric, oranges, and your different types of fruits and vegetables helps keep your immune system strong. And during this invasion of cancer, there's these cells that change. There's sort of a mutation, and this inflammation that comes from the environment and from the foods that we're eating can exacerbate the mutation causing the cancer. So trying to limit those refined foods. So rather go for your natural foods. I know it's difficult here in Cayman because we're getting all our food from a ship. So try and have a veggie garden at home and plant your own herbs and spices. Try and make your own little, you can make a mushroom, you can plant a little mushroom in a beer box or in a planter on your windowsill. You don't actually have to have a giant yard to be growing your own types of fruit and vegetables. Another thing is to be taking in a lot of, I know in Cayman we have taken a lot of fish, which is great. So your mackerel and your salmon and your tuna, those are your oily types of fishes. Try to have at least 2 portions a week. Then also trying to have less sugary foods. So I think, have you ever heard that no, sugar leads to cancer, and it also exacerbates cancer? Have you ever heard that before?
That no sugar, or that sugar
having an excessive amount of sugar can lead to it.
Mean, I think we've heard that cancer cells feed off of sugar.
Yes, so, but it's actually the same thing as the alcohol. So you're taking in your fatty foods, your takeaway foods, your foods that are very low in nutrition. So it has no macronutrients like the proteins and the good fats to help keep your immune system strong and rebuild and repair your cells. So you're going to be taking in the sugary content foods, which tend to cause bloating, or they make you feel unwell, or they give you the sugar high and then you got lots of energy and then you feel just lethargic afterwards. So then you're more likely not going to be cooking homemade food for the next meal, and you're just going to be full. So it reduces your variety and your amount of meals you're going to be eating in the day. But then again, you think, okay, you must try and keep good weight, you must try and diet. You don't have to. You just need to include healthy foods like your omega-3 fatty acids, your eggs, walnuts, flax seeds, and chia seeds. And you can add them to, like you can add in your nuts with your smoothie in the morning on your oats. You can try and pack in a lunch box with your own types of mixed berries. You can also have hummus is really great. I know you can try and go to one of the grocery shops and crush your own nut butter, and then just put that on some crackers or add it with your fruit or your vegetables during the day. So trying to increase the amount of healthy foods while decreasing your sugar intake. There's also, if you go to one of the grocery shops, you can get your LaCroix or your bubbly, and those are naturally flavored. And instead of having your energy drinks, or they usually say when you're sick, have an energy drink, it will give you energy to do things, but it actually is very high in sugar. So remember to read your labels.
Wow. Okay. Well, Ms. Kaylee, we're going to be talking a lot with you in the very near future, because we need some of these practical things. And sometimes going to the grocery store and trying to determine what's healthy and what isn't, even when you read labels, can be so confusing.
They lie to you.
Yes, I've seen it. So I'm looking forward to us, taking some of those trips and really breaking it down. So Dr. Kumar and Ms. Kaylee Nowers, the registered dietitian, have joined us today, folks. We're talking about basically just breast cancer, prevention, awareness, some of the things that they know are leading, sort of contributing factors when it comes to getting breast cancer, and how you can work towards avoiding some of those. Now, of course, here in CMR, we're all about dispelling myths. So let's talk about the top 5 myths that relate to breast cancer, and we can end the program after that. So the first myth is a breast injury can cause breast cancer. Dr. Kumar, is that true?
No, see, a direct injury cannot cause breast cancer, but definitely injury can lead to infections leading to swelling in the breast that may mimic like a breast cancer. For example, a lady get confused that this swelling is because of cancer or not. In that case, she can come to us, we can examine it, and we find that there is a definitive signs of injury, then definitely we can wait, give anti-inflammatory to that lady, give some warm water hot fermentation, so that it should reside. And but again, it can lead to swelling, but it cannot directly lead to a cancer. But definitely it has been seen that if it's a chronic injury, I mean to say, if repeated injury is going on, that may lead to some of the skin changes that later in the life, very later in the life, may change into some kind of growth. but there is no direct connection between any acute injury leading to cancers.
Right. Okay. And myth number 2, underwire bras increase the risk of breast cancer. Now, they may be uncomfortable, which is a whole other thing, but there's no known increase in risk.
No, there is no risk. But again, I don't recommend such kind of underwire bras to especially young females, because again, they will lead to some kind of injury any time of their life, and they may lead to swelling and all, and just scare them up. So it's better to, but again, it's their personal choice.
Sure. Nipple piercings. This is a new myth. Nipple piercings increase breast cancer risk.
No, again, answer is no. It's a myth. Why? Because nipple piercing may lead to a type of fibrosis at the site of insertion later in the life when the piercing is removed. But fibrosis is basically a contracted tissue. This is not a cancer. So nipple piercing can never lead to cancer, but definitely it increases a risk for other infections like HIV, STDs, etc. Different kind of risk can happen. But again, there is no direct connection between nipple piercing and breast cancer.
Okay. And myth number 4 is men do not get breast cancer.
No, this is not like this. Men also has got breast, though this is rudimentary breast. So overall, the chances of breast cancer in male is much, much less. If you go with the figures, it's about 0.5 to only 1% throughout the world. The rest, 99% happens in ladies only.
But interestingly enough, that's very minimal. But, I know of at least one person in the Cayman Islands who actually found out that he had breast cancer.
Yes.
So men should pay attention.
Yes. Again, the treatment and screening remain the same. It's not different from them. The incidence is less, but the treatment and screening pathways remain the same between all male and female patients.
Right. So should men be doing breast exams as well?
No, again, there is no such recommendation for males for their breast examination. But if they found some significant swelling, nipple discharge, or discoloration of the nipple or disfigurement, definitely they should contact to their doctors. But for them, manual breast examination is not recommended for males until unless they have got significant history of family and all. But again, since the breast is rudimentary, so there is nothing to do regular basis breast examination in males.
And our final myth is, if there is no lump, there is no cancer.
No, answer is a big no, because there are almost 50% of the cancers which present without any lump. I mean to say, there are different cancers, for example, ductal carcinoma, which we call. This happens when in the early stage, there is no obvious lump, and it's in the duct of the milk secreting glands. So answer is no. So if you feel that there is some discharge or any kind of nipple disturbance, definitely you should contact doctor, and he may advise you for screening and later on biopsy or FNAC accordingly if required.
Okay, wonderful. Well, thank you so much, Kaylee and Dr. Kumar, both of Total Health. Folks, their facility is located on West Bay Road in, let me remember the center now. Help me out here, Kaylee. And oh gosh, the name of your plaza is called?
The Grand Pavilion.
The Grand Pavilion. Yes. Thank you. I always forget that one. So again,
it's on the left-hand side.
Yes.
You'll see the pharmacy sign.
Yes. So folks, just remember that breast cancer is common, as you can see from earlier in the conversation. But with a healthy lifestyle, you might actually have the opportunity to reduce your risk to a certain extent. But vigilance remains the key. That's what it's all about. Early detection. So folks, please make sure that you speak to your personal physician. Dr. Kumar is obviously available. You're speaking to your dietitians, your nutritionists about the health changes that you can make that will not only keep you slim and looking nice, but also have a lot of health benefits as well. So the chances of you catching it early means that you can survive it. It's now very, very survivable. It's considered a survivable disease. So thank you so much to both of you for joining us today.
Thank you. Thanks, Sandra.
So much.
Okay.
Thanks.
Have a good day.
Okay, thanks.
Bye, everyone.
Goodbye.